I think that's a good segue into your book. Tell us about your book, Nurses Take Back Healthcare, one
Well,
employee at a time. Tell us about this.
so this was really kind of funny because the whole reason why I wrote this book was because I was angry at Dave Chase. he
Explain. I'm
he
ignorant. Tell me who Dave
you're
Chase is.
okay, so Dave Chase came out with a book, and he's a writer and he's a marketer, and he's very, very eloquent. He did a TED Talk, and he's a great guy, right? And he developed this organization called Health Rosetta, and he published a book that said, I can't remember the exact name of it, but something about a letter to the CEO as to how healthcare stole the American dream, right? And so I read his book, and I'm like, he's spot on. But how you're not a clinician.
Right.
What is this all about? And so I said, let's look at this from a clinician's viewpoint. So that's why I wrote this. And the reality is that there is so much focus on that middleman, the broker, right? Millions and millions and millions of dollars into these brokerage firms, and all they're doing is pumping wellness, which is, let's put an apple in your vending machines instead of soda. No, that's not the people who are already healthy have a tendency to perform well in that realm. And it's the people that are in that middle spot. They don't have a diagnosis yet. They're going to be heading that direction. That's where your focus should be. Keep the healthy people healthy. Put apples in your machine. Give them water instead of pop. Everybody knows that stuff. We don't need to pay for it in addition. Don't have smoking policies on don't let them smoke in your factory, whatever. Yeah. But it's that middle population. That's where we should be spending most of our time, and making sure that they have all the services, and they're probably not even thinking about it.
Well, and speaking of your book, I love the name, by the way.
Oh, thank you.
Yeah, I'm gonna just add to it a little bit.
Okay.
I have a lot of and I'm sure as well as you do, I have a lot of doctor friends.
Right.
And they often say doctors need to take healthcare back. And really what it is healthcare professionals need to take healthcare back, right?
Right. And I only want the very best doctors to go along with me.
Well, and not the ones that are the preferred provider for bucas, right?
Or the one who is going to a different state to pick up patients because no one in that state will go. I want the very best doctors alongside me. Yeah.
And if you remember, when I practiced in a pharmacy, in a hospital pharmacy, 25 plus years ago, mm-hmm. I mean, basically it was, many, many years ago, it was basically doctors and nurses that took care of patients.
Right.
Now there are so many people involved in that process that mm-hmm. have nothing to do with clinical care whatsoever.
Right.
Right.
And that was the beginning of the downfall. I can mark it down to 1992 was when we said, oh, there's a nursing shortage. No, there's never been a nursing shortage, people, ever in a million years. What happens is we get burnt out. Yeah. And in my day, we got burnt out in 10 years. And now the burnout rate is 2.
I was going to say, right. Yeah.
Yeah. We just go do other things because we can't do it anymore.
Yeah.
So, and we're that sandwiched profession in between the patient and everybody else. So, but the physicians, I have gotten to the point where it's the physicians and the nurses and the other clinicians that are willing to walk away from the money and go to their profession and try to do it on their own. Those are the people I'm looking for.
Absolutely.
Because you got to walk away from the money.
Yeah. And that's one of the things is that the system, big healthcare corporations, hospitals and big corporations, they have so much money to offer these physicians mm-hmm. and nurses too, that it's hard for them to say no. But mm-hmm. in reality, you have to have some ethics That's why we went into healthcare, to take care of people. And ultimately, we just have to take care of patients and not worry about a big salary. Unfortunately, the system is rigged against us, especially now with how expensive college is and all that kind of stuff. So these physicians come out with huge debt. So these hospitals offer this guaranteed salary for 2 years that is huge. And it's like, wow, I can pay my debt back now. So,
well, we also need to redo our education systems too while we're at it.
That's a whole other podcast, right?
Right. And we also need to reconvene our licensing boards and get them under control as well. So it is, I personally think that if we really wanted to do it the right way, everybody should go through nursing school first. And then if you want to branch off from there, great. But you've got to get that patient component done. There's too many people. I used to train physicians as they were going through, and this is how you run a code, right? And then a year later, they're being nasty to me, and I'm like, listen here, buddy, I trained you.
Right.
Where are you coming from? So anyway,
I've seen nurses save so many physicians' butts. It's awesome.
Right. But it's like but that's okay. I'm okay with doing all of that. But I don't want to diagnose and come up with the treatment plan. Right? That's not not my passion. My passion is taking the best, brightest physicians' diagnosis and treatment plan and then caring for the patient. That's, you know what I mean? So it's like everybody's got their role, but you've got so many techs and people that aren't nurses. So I always tell people the last place you want to be if you're really, really super sick is in the hospital.
For sure.
And that the people that you think are nurses are not nurses.
Yeah.
They're techs.
Yeah.
And so if you are waiting for that tech to, now, not all techs are terrible. There are some that intuitively pick stuff up, but that's one of the reasons why I left, because I can't let the patient that has the big sign on their wall that says complete bed rest because he's got clots, don't get him up to the bathroom.
Yeah.
You know, it's those types of things that I just couldn't be bedside nursing anymore.
Yeah. Well, and I mean, by design, and thank goodness is that, and this is why I love nurses. One of the reasons I love nurses is, they are patient advocates. I mean, you guys are the biggest patient advocate out of anybody on a healthcare team. And that's what you guys are trained to do.
That's right.
I mean, kind of like first and foremost, maybe, I don't know. And so that is why it's so important that, the terms we use in healthcare, I mean, a lot of people get called nurses, but are they really a nurse? I mean, we're
right.
by training. That's really important. Same thing with physicians. I mean, a lot of people get called doctors now
right.
in the healthcare field, but they're not really MDs or DOs or not medical doctors. So,
right.
We need to be careful about those terms. So,